Hi, my name is Dr. Michael Veslak. I'm a chiropractor and have been practicing chiropractic for over 30 years. I'm a board-certified integrative medicine, and today we're going to talk about how you can beat thyroid disorders naturally. So the goals of this DVD are four things. I want to have a maximum positive impact on everyone I come into contact with. I want to give you tons of great information. I want to reinvent your life, and I want to teach you how to beat thyroid disorders naturally. I want to be real clear on one thing. I do not treat or cure thyroid disorders. I'm going to show you the latest non-surgical, cutting-edge, non-drug breakthroughs in thyroid care. So have a paper and pen ready. You're going to probably want to jot down a few important facts. So first I'm going to address the cause of your thyroid disorder, which are a few things. Number one, inflammation. Two, toxicity issues. And three, a decreased immune system. Many of you continue to struggle with chronic thyroid symptoms day in and day out. You've been to your doctor, they've ordered some labs, came back your TSH was a little bit high, so they prescribed medication, usually in the form of Synthroid or Armour. So now what? Well, they retest you, your labs are in the normal range, so is your thyroid fixed? Why do you still have symptoms? Some of the symptoms of hypothyroid are you can have fatigue, you can be tired, you can have cold feet or hands, sometimes depression, morning headaches, you can gain weight easily, difficulty with bowel movements, require excessive amounts of sleep to function, thinning of hair is common, dry skin, and sometimes the outer one-third of the eyebrow could thin also. The signs of hyperthyroid are heart palpitations, inward trembling, an increased pulse rate. You can be nervous and emotional, have night sweats, have difficulty sleeping or have insomnia, and difficulty gaining weight. Now with Hashimoto's thyroiditis, which is an autoimmune disorder, this is where the patient's immune system actually attacks the thyroid gland, many patients suffer from some or all of the above symptoms. 90% of hypothyroidism or low thyroid is caused by an autoimmune thyroid condition. In 1998, the Journal of Metabolic Endocrine Disorders, the #1 thyroid journal, stated this. So how do you stop your immune system from attacking your thyroid? Well, three things mainly. You have to detoxify the body, decrease the inflammation, and build up the immune system. So how do you know if you have autoimmune thyroid? Well, generally lab tests are run checking the antibodies TPO or TGB. Oftentimes though, your doctor won't run these because the treatment for hypothyroid and autoimmune thyroid has been the same in the medical literature since 1960. The reality is, if you have a Hashimoto's or autoimmune thyroid, it's completely different than having a hypothyroid. So some of my patients, when they walk in, they haven't had these tests. My hunch right away is they have Hashimoto's for a few reasons. One, they usually come in with a suitcase full of supplements and a medical file that is so thick because they've been to 12 to 15 different doctors trying to figure out what their issue is. So I get asked all the time, can I still suffer if my thyroid's been removed, or if I have goiters, if I'm taking a synthetic hormone, or if I add T3? And the truth is, many of you that are taking Armour and or T3 still feel horrible. So with the thyroid gland, there are a lot of interchanging parts. We call it the web of physiological dysfunction. And your thyroid chemistry is different from anyone else. One system, and they are all connected. So in medicine, if you have a problem with your stomach, what you'll normally see is a gastrointestinal doctor, and he'll diagnose you and give you treatment for that. If you have a hormone problem, you'll see more commonly, if you're a female, an OB or a GYN, which will regulate your hormone levels. And perhaps you've seen an endocrinologist or a thyroid specialist. The problem is nobody actually connects all the dots and looks at all your systems to how they're functioning to figure out where the breakdown with the thyroid gland was. So again, the cause of thyroid problems are three things: massive inflammation, toxicity, and a decreased immune response. So the number one cause of inflammation that we've seen in our office is acidity. Most patients have a problem with having too much acid. The ideal pH in the body should be 6.4 to 7.0. You need an alkaline pH to heal. So above 7.0 is not good also. We've had some patients take alkaline water where their pH gets to be that 7.2, 7.4. That's as bad as it being too acidic. So how do you test for it? Well, what we do is we give pH strips. And these pH strips, you take your first morning urine, you run the pH strip right under the stream, and then you measure to see what your pH is and you report it to us. The most common cause of stomach acidity are poor diet, toxins, sometimes dental infections, and heavy metals. So calcium, magnesium, and trace minerals are very, very important to a thyroid patient. If you are acidic, you are at greater risk for heavy metal toxicity, which in turn will cause a downward spiral of these free radicals. So it will also, if you're too acidic, create an environment for viruses and bacteria to flourish. People become more susceptible to colds and flus when their immune system is not functioning properly. So how do you become more alkaline? How do you change this? Well, most importantly, you have to change your diet. You have to eat less red meat. You have to drink more of the good water. You have to eat more veggies. And of course, proper nutrients in the form of different supplements. We like certain mineral products. We like products from premier research labs called Coralegin or Allopro and Allomannan. We like pH salts and alloferox from Immunologics. And then we recommend D3 to a lot of our patients. We want you to stay away from the cheap nutritional supplements. I mean, I know you go to Costco and you can see this great bargain they have in these supplements. The problem is these supplements have different excipients or things that shouldn't be there. So sometimes you can take a cheap B vitamin that can be derived from coal tar. You can have enriched foods that are made of rock iron. Some common foods like this are pastas, bagels, cereals, crackers, waffles, buns, rolls, and pancakes. So it's important to get a very, very high grade supplement to make sure it goes to your cells. And when we started using a few different supplement companies, we saw a tremendous change in our patients' health. So as I just talked about, overconsumption of these enriched foods will affect the production of tyrosine, which is needed to make your T4 hormone. So as we'll go over in a little bit how that T4 and T3 are made, tyrosine is a very important component. When we consume these enriched foods, it signals to the liver not to absorb more iron, which is needed to form that tyrosine. So synthetic nutritional supplements can actually cause free radicals and excitotoxins, and sometimes they're full of these xenoestrogens, which can create a hormonal imbalance in your body. As you probably are well aware of, these free radicals and excitotoxins can cause a massive inflammatory response, increase toxicity, and decrease your immune system. So the number 2 cause of the massive inflammation, toxicity, and decreased immune response are free radicals and excitotoxins. Free radicals generally are caused by a poor diet. The use of trans fatty acids and hydrogenated oils, diets high in refined sugar, white salt, white flour, and then sometimes food sensitivities. We see very commonly food sensitivities to gluten, dairy, and soy. There can be toxic chemicals. Sometimes there are hormones that are put in our meats, sometimes in our dairy products. It's common to have pesticides in our fruits and vegetables. So we're constantly being bombarded by these different chemicals. At times, heavy metal toxicity can come into play. You can have fillings in your mouth, mercury amalgams. There can be aluminum in your antiperspirant deodorant. Sometimes our packaged foods come with some heavy metal toxicity. And then hair coloring and dyes is another very common source for heavy metals. Excitotoxins are basically neurotransmitters which can cause cell death when their actions are prolonged. They cause premature death by initiating the p53 gene. So some common excitotoxins that we consume are glutamate or monosodium glutamate, more commonly known as MSG, and aspartate, which is found in NutraSweet. There are 182 references citing these facts. The third cause of massive inflammation, toxicity, and decreased immune response is infection. So we have found in our practice, and it's becoming more widespread knowledge, that dental infections, root canals, can be the source of infections that cause these chronic health problems or thyroid issues. We have found gut infection caused from parasites, H. pylori, biofilms, or mycoplasms. Organ infections, commonly liver flukes, can create a lot of havoc and decrease that immune response and increase inflammation in the body. These can all have an effect on the thyroid gland. So mercury, we all know that can be in our fillings. We all know they can be in our fish. But what we didn't know is sometimes the grains and produce where they store them, they use mercury fumigants to control pests. So we're constantly bombarded again by these toxic chemicals or heavy metals. So what protects us from this heavy metal exposure? Well, our parathyroid gland. Our parathyroid gland is oftentimes involved when we have thyroid issues. Its major function of the body is to maintain calcium levels. It buffers the blood. So if the parathyroid is not working properly, your blood will not become buffered and you'll become too acidic. So again, here's that web of physiological dysfunction. We talk about acidity, and now we have the parathyroid gland. If it's not buffering the calcium like it should into the blood, you can again have acidic issues. The parathyroid gland is the most sensitive organ in the body for heavy metal toxins. We utilize a product called Green TND, again from Premier Research Labs, to help support the parathyroid gland, and we've had tremendous success with this. The fourth cause of massive inflammation, toxicity, and a decreased immune response is autoimmunity. And we're seeing in our practice more and more patients are becoming autoimmune. So, the autoimmunity basically means your immune system is attacking your own body. So how do you stop that? Well, you need to, again, decrease the inflammation, detoxify the body, and help build up the immune system. In the immune system, there are basically two parts. You have the Th1 and Th2 system. And you need to balance these two out. It's almost like you think of a teeter-totter and they should be in this perfect balance. But sometimes we get bombarded with Th1 stimulants or Th2 stimulants that can create an imbalance here. So what I tell my patients is that Th1 is your adaptive immunity. It's your Pac-Man of the body. It sees a virus or a bacteria and it goes there and it attacks it. And then what happens is the Th2, which is your acquired immunity, or adaptive immunity, this is your antibodies that actually tags the bad guys, so your body remembers this, so it can actually be more effective in treating it and killing the virus and or destroying the bacteria. If they're not in balance, your body's going to have a hard time destroying these problems. So what I want you to know though, and this is a fact that most people don't know, is 80% of your immune system is located in your gut. So if your gut is not functioning properly due to these bacterial, parasitic, fungal issues or food sensitivities, your immune system just can't work effectively enough to take care of the immune issues that you have in your body. So one of the things that we do in our clinic is we always evaluate the gut for pathogens and to see if there's any what we call dysbiosis, and then we effectively treat the gut to allow your body to deal with the immune response and handle the inflammation in the body more effectively. So the two common problems we see in our office more than any other is the hypochlorhydria, which is not enough acid to help break down the food, and gluten sensitivity or intolerance. There's been a lot of literature in PubMed about how gluten can directly affect the thyroid gland and increase the patient's or person's ability to become autoimmune or have Hashimoto's. So hypochlorhydria, we talked about a little bit, is the decreased stomach acid, the HCl. And HCl is really important for a lot of reasons. One, it helps increase the flow of your lymphatic system, which gets rid of your toxins in your body. Two, it helps create methyl groups. And methyl groups, which I'm going to talk about in a little bit, is extremely important for your overall health. So how do you test for this? Well, we do blood work. In our blood work that we'll run, we're looking at four things basically: total protein, your serum globulin levels, the BUN, and phosphorus. If we find these are a problem, that we're thinking that you have not enough stomach acid to help effectively with your lymphatic system and creating these methyl groups. So the second thing we do in our office is we do a technique called applied kinesiology. Again, I'm going to talk about that in a little bit. What I want you to know, though, is in our country there are $40 billion in sales in antacids. But the reality is, when you don't have enough acid in your stomach, you cannot break down the food properly. So this food pretty much ferments in the stomach, and then it's actually lactic acid that creates the heartburn. So it's not, the antacid's really just covering up a symptom. It's not really taking care of the problem. So methyl groups. I want to just talk about these a little bit because most people have never even heard of what it is. But methyl groups are basically, they turn on and off good and bad genes. So if you are depleting your methyl groups, it's going to turn on the bad genes like an autoimmune disorder, Parkinson's, multiple sclerosis, and or cancer. So we talked about it. What the HCl is what helps create the methyl groups. So you need to have enough, your acid balance in your body needs to be at a certain level. It's very important to have a proper HCl in that stomach to restore your depleted methyl groups. They're also, not only are they responsible for turning on and off the genes that we talked about, but they're also very important for your detoxification pathway and a lot of the synthesis of your neurotransmitters and your nucleic acid, and very important factors and production that goes on within the liver. They have determined that inadequate methylation can cause birth defects, cognitive decline, depression, and or cancer. So now what? Well, we've identified the thyroid disorder is caused by inflammation, toxicity, and an increased immune function. I should say a decreased immune function. The four things that affect that are acidity, free radicals and excitotoxins, infections, and autoimmunity. How can you identify the problem? Well, I'm asked that all the time. And we do two things. We run the labs, and sometimes we run very specific labs like we talked about. And then we also do a technique in our office called applied kinesiology. So before we talk about the lab testing of kinesiology, though, I want to just give you a few facts about the thyroid gland. I think you need to know a little bit more about the physiology of it to understand more what your condition is about. So the thyroid gland is basically, it's the gas pedal of our body. Every single cell in your body has a receptor site for the thyroid hormone. And these hormones are responsible for every basic function impacting all the systems of the body. It directly acts on your brain, your GI tract, your gallbladder, your steroid hormone, glucose, cholesterol metabolism, body temperature, protein metabolism. I mean, it can handle anything. That's why when you have a thyroid problem, your symptoms can be so varied from patient to patient. So how does it all work? Well, we talked about the web of physiological dysfunction. And when you're thinking thyroid gland, you're not really thinking of the brain, but that's where it all starts. It starts with the hypothalamus and pituitary gland. The hypothalamus signals the release of a hormone, and it's called the thyroid releasing hormone. And this signals for the pituitary gland, which is the master control, to release the TSH, which most of you have been tested for and determine that you have hypothyroid when it's actually too high, meaning hypothyroid. So the thyroid receives the message from the pituitary gland, and then it will make some hormone. And hormones, what they basically are, they're chemical messengers telling one part of the body what to do. It's like lab tests tell doctors it determines the function of the thyroid gland, and the main test we utilize is the thyroid stimulating hormone. So when the body realizes that the T4 is getting low, it messages the hypothalamus to release the thyroid releasing hormone, which signals the pituitary to release the thyroid stimulating hormone. This stimulates an enzyme called TPR, and the enzyme tells iodine and tyrosine to make T4 and T3. So T4 basically means this. T4 is 4 molecules of iodine attached to a tyrosine. T3, 3 molecules of iodine attached to tyrosine. So when the thyroid gland releases the T4 and T3, it kind of filters down, and 93% comes out T4, 7% comes out T3. So from there, once it's released, it attaches to a protein, and this protein then transports it to the liver. And when it's in the liver will then convert it to what we call free T3, which is a usable form of the thyroid hormone. 60% of this T3 goes to every cell in our body. 20% goes to what we call reverse T3, which is basically inactive and does not do any work at the cell level. And then 23% goes to what we call T3S and T3AC. These are also inactive. So basically 60% of T3 goes to every single cell. So if you have a healthy gut, these are converted back to a free T3 form so you can still use them. These hormones then go back to the liver, kick off the protein, and then go to the receptor sites in the cell. Each thyroid hormone, once it gets to the cell, it must fit in there perfectly. It's like a lock and a key. And then it stimulates, the RNA messenger and different metabolism like protein, carbohydrate, and fat to actually work. So the metabolism, when it slows down, that's when you have hypothyroid, because it's not actually getting to the cell and making actually your metabolism work. So the gold standard that we test thyroid hormone for is thyroid stimulating hormone, TSH. So if your T4 is low, they prescribe Synthroid or levocethirin. If the T4 will cause your levels to elevate in your bloodstream, it will then send a message to your pituitary, and then you don't need TSH anymore, so your lab ranges look normal. So unfortunately, the level of care that when they give you the hormone only addresses 3 of the steps. There's 7 other steps that it never addresses. It never addresses the conversion of the liver. It never addresses the conversion in the gut. It never addresses going to each cell and all the things that can happen there. So really, when they give you the hormone, it only covers 3 of the potential 10 things that can potentially go on with your thyroid hormone. And that's why some of you with prescribed the TSH, the synthetic hormone, you didn't feel any better. So there are a lot of things that can go wrong. I mean, it's the web of physiological dysfunction. Your cortisol levels, if you have too much stress, can be high, which will cause the pituitary gland not to function properly. You can have a problem with decreased progesterone, which affects the transport of the thyroid to the liver. You can have a problem in the liver where the detoxification pathways aren't functioning properly, so you can have a difficulty converting T4 to T3. There are other things. You need different minerals, zinc, selenium, to convert the T4 to T3. So a low selenium level in your body would cause an inactivity of T3. We talked about the gut, how it has to be healthy to convert that 20% to bring it to the receptor sites. So, and what we have found is most thyroid patients actually have unhealthy guts because they are constipated. So the other things that can happen is at receptor sites, if it doesn't fit perfectly, if the lock and key is just not right, you need certain minerals to make it right. You need calcium, magnesium, and other trace minerals. Another thing that's really common these days is what blocks the receptor site are plastics. You have BPA, which we are taking in almost 210 micrograms a day, which can usually comes from these plastic water bottles that we drink all the time. This can block the receptor sites, as well as too much estrogen can block the receptor sites. And if they're blocked, the hormone is never going to quite get to the cell. So remember, I said every cell in the body has a thyroid receptor site. So, but here's the reality. All this that I talked about, the thyroid gland, 9 out of 10 of you, none of this even matters. And the reason is because you have an autoimmune thyroid, Hashimoto's. So if 80% of the immune system is in the gut, and you get ramped up inflammation from all the things we talked about, the acidity, the chemical barrage, the heavy metal, the parasites, the bacteria, the viruses, and if the inflammation is ramped up, it's eventually going to attack the thyroid tissue, and the body's going to attack itself. So, and this isn't effectively treated with Synthroid. It's not effectively treated by any of the prescription medication. That's why you're on it, your lab ranges are normal, and you still do not feel good. So what you have to do in this situation is, and this is extremely important, you have to modulate the immune system. You have to regulate it, because it's more of an immune issue, autoimmune, rather than just a thyroid issue. So, what turns on a bad gene? We talked about it. Methyl groups, lack of hydrochloric acid. You got to make sure that hydrochloric acid level is good to turn the good genes on and the bad genes off. They did a long study, and they said 95% of our genes we never express in a bad way. Only 5%. So we've always heard, oh, I got bad genes. Oh, it's genetic. Probably not. Our diet and our lifestyle is what really affects them more than anything. So another thing that can turn a bad gene on is estrogen. So if you think back, when's when you started having symptoms, was the first time when you began having your cycle, like around age 11, 12, or 13? This could create a brain fog in school where all of a sudden your grades dropped. You're a straight A student and you just had trouble concentrating, and everybody was talking about going through puberty. But the reality is, it could have been the start of the Hashimoto's. The second time the estrogen becomes an issue is when a woman gets pregnant. So they're diagnosed after they have the baby with postpartum depression. They prescribe antidepressants. But reality is, what happens with that estrogen, like going out of control or increasing, it can actually again stimulate that thyroid autoimmune condition, and that can be creating the depression, as we saw was one of the symptoms of the hypothyroid. And the third time is menopause. So hot flashes are really that sudden spike in estrogen. So this could have been the trigger. Dietarily, what we've seen, and it's been documented in the literature, is dairy, soy, eggs, or gluten can be the cause. So in conventional medicine, the most overlooked gland in the body is the thyroid gland. And the reason is because they never do the proper testing. They never run the antibody panel to see if you are autoimmune. So what we do is we remember the web of physiological dysfunction, and we'll test the thyroid, we'll test the adrenal glands, we'll test the gut, we'll test hormone levels, we'll potentially do a stool sample. And we in our office, our motto is we leave no stone unturned. We get to the bottom of it, and hopefully that makes sense. So we've also found there are certain deal breakers, health breakers that go along with your thyroid condition. You can have, we've talked about a few of them. You can have gut dysfunction. You can have blood sugar imbalances, anemias, autoimmunity, sometimes liver gallbladder issues, carbohydrate metabolism problems, dental infections. There's so many different causes. So what we like to do is do our testing to figure out what that cause is. So in our office, we do the standard blood workup. We do a complete metabolic panel. We'll check blood glucose, liver, gut function, kidney iron levels. We do different tests for inflammation called CRP or homocysteine. Check your vitamin D levels, and then we run the complete thyroid panel. We do the TPO test, the TGB, TBG, CBC, and we really figure out, is this autoimmune thyroid right from the beginning. We like a lab called Cyrix Labs. They are leading the country right now in sensitivity and reactivity testing. We test different arrays depending on what the patient's symptoms are. So array 2, we determine, does that patient have a leaky gut and what's their gut function like. Array number 3 is gluten reactivity. It tests 13 different forms of gluten and to see if you react to which one. We run a cross-reactive panel. There are actually 18 foods that react the same way in your body as gluten and dairy. So if I have patients come in, they go, "Doc, I'm gluten-free, but I'm still having all these symptoms. I'm bloating up, my stomach cramps up, but I'm not having any gluten, and I cut out all the little trace gluten." Well, these 18 foods have a very similar molecular structure to gluten, so they mimic the reactivity in the body. So sometimes they'll react exactly like gluten does in the body. So we run that test to figure out which one of the 18 is it. Is it rice, potato, corn? They're so common in our diet, we can't restrict all of it. So we want to find out which one do you react to. And then on occasion we'll run array 5, which is the autoimmunity panel. This so we can specifically see, are you autoimmune in this gland, and or are you about to become, so then you know you need to take certain measures to prevent yourself from becoming autoimmune. At times we'll run the organic acid test. So the organic acid test will allow us to look at fatty acid, carbohydrate, your energy levels, your B complex markers, methylation, cofactors, neurotransmitters, and detoxification markers. We'll run stool microbial tests, parasites. We want to rule out bacterial problems, fungal problems, molds, and sometimes viral. And we'll run a adrenal stress index. It's a saliva test that can test adrenal glands, measure cortisol levels, DHEA levels. And at times, again, we'll run, and it's not for everybody. We determine what the needs are of that patient, depending on what their symptoms are and what their other tests look like. But we'll run hormone panels. We like to use BioHealth, which is in San Diego, to really look at the 24-hour cycle of estrogen, testosterone, estradiol, and progesterone. And sometimes we'll even run it over a 30-day period to really get down to the bottom of it. So we utilize in our office what we call functional lab ranges. And these lab ranges, they give us guidelines onto what a patient might have. So we take the normal lab ranges and we kind of shrink the values a little bit. So for instance, if a patient has a glucose issue, we'll look at the glucose markers, and lab ranges usually are a normal 70 to 110. But functional ranges shrinks those numbers a little, tightens it up, and the lab ranges functionally are 84 to 100. So if we've seen them in our office and they're 83, which is still well within normal limits for a glucose panel, we'll ask the patient, do you get spacey if you don't eat? Do you pack snacks in your car, in your purse, or in your desk? And the answer is always yes. So that's a sign of hypoglycemia. So we tighten those ranges up and we look for patterns and extremes. And that way we can really figure out what's going on within that web. The other form of testing that I said we would talk about is kinesiology. And with kinesiology, we like to test the different interference fields in the body. So we'll check through acupuncture meridian points, the sleep point. We'll check the energy point, thyroid, parathyroid, stomach, sometimes liver, adrenal. And we go through and we assess to see if there are any interference blockages. Some of the common blockages that we see are traumas, could be a surgery, sometimes a old fracture. Sometimes interference fields with the thyroid are chin issues, nose, scars. We want to look at the clavicle. Sometimes C-sections can be an issue. And we like to evaluate these interference fields to see if there's any blockage of any energy going to that thyroid gland. So it's our goal in our office to customize treatment plans to support your body, each individual patient, and the thyroid. So we make our assessments and our treatment plans based on the labs and then our kinesiology testing. So it's important to remember, we do not treat the thyroid. We utilize more integrative approach that we look at it from all aspects to try to figure out what we need to do to make that patient better. So certain things we'll utilize is proper nutrition. We'll tell the patient avoid foods that create more of an acidic environment. You know, meats, trans fatty acids, bad oils. We all know this stuff. Drink half your body weight in water is important. We want to supplement with really good supplements and herbs to avoid all those excipients. We want to exercise at our aerobic level, which is 180 minus the heart rate. That's 180 minus our age. That should be the heart rate, your aerobic rate that you exercise at. So every single patient's plan in our office is different. And the reason is because every patient is different. Their lifestyle is different. Their labs are different. The reasons why they have a thyroid problem is different. So it's basically our goal to reinvent your life. We find the most effective natural product to enhance your body's function so that you have the best possible chance of living a long and very happy life. So how do we help you? Well, we decrease inflammation, detoxification, and improve your immune system. I've said it over and over. Decrease inflammation, we detoxify you, and improve your immune system. So, if your pH is 6.4 to 7.0, we like to improve this by juicing organic vegetables. Sometimes we'll, even if the liver is really bad, we'll recommend coffee enemas to help detoxify the liver. We will do other detoxification therapies in our office, like foot baths through our Rife. We'll do a ionic foot bath. We'll check interference fields through cell phones, dental work, infections, and then at times we'll even mud pack these interference fields to clear them out, to draw the toxins out. We utilize in our office EWAT or oxygen therapy. And then we base our protocols, our natural protocols, on our kinesiology after we test you and then by looking at your labs. We'll also do neurological testing and support. So to give you an example of a sample treatment plan is we had a patient a few months back come in our office, 38-year-old female. She was suffering from hypothyroid for over 10 years. She suffered from extreme fatigue, anxiety, depression, weight gain, and she had insomnia and she was unable to conceive children. She was taking Synthroid and she was also taking antidepressants. So what we did is we did a complete evaluation. We did an evaluation on her structurally, chemically, emotionally, the EMFs, and we ran certain labs. We ran the Cyrix labs, the ASI, we ran the organic acid test, hormone test, we did the applied kinesiology, and we told her to start eating better. We gave her organic vegetable juicing. We gave her vitamin D and essential fatty acids. We gave her a drink for her to sip through the day. It's called an infusion drink. We talked about her dental infections, and we did mud packs in the upper right part of her mouth. We also found interference fields throughout her hands and her feet. We gave her a product that we like a lot. It's called co-curcumin, which to decrease the inflammation due to her high homocysteine levels. So, and then we gave her green tea to reduce her IL-6 or inflammatory markers. We gave her the HCl. We gave her another product called Max B and D, the vitamin D, the essential fatty acids, and then a few other products, green tea, melatonin, and tranquinol. And here's what happened. After 3 months, she had more energy, no longer fatigued. She was sleeping 7 to 8 hours per night. She no longer suffered from anxiety and depression. She was no longer needed her antidepressant, but the most important thing, after 8 years, she was pregnant. So you think she was excited? So our thyroid recovery program works. Remember, we don't treat or cure the thyroid. It's a recovery program. We help support the body so the thyroid gland can function more properly. So our average program is about 6 months. Some are 3, others are a little longer, but the average is between 3 and 6 months. And the reason why it takes so long is, one, most patients have other issues. They have diabetes, anemia, maybe autoimmunity, and we have to deal with all these issues to see if there's a change. So we just have a few simple rules. 1, if your health is not your #1 priority, this program is definitely not for you. 2, if you are not a 5 on a scale of 10, this program is not for you. We accept only qualified and committed individuals. And I'm asked all the time, okay, doc, what's the cost? So our cost is $195 for our consultation. We ask you, when you come, please bring or forward your most recent labs and any pertinent medical records that you have, so we can really analyze deeply, do we need to run more tests, or are these sufficient enough so we can figure out what the cause of your problem is. We want to let you know that unfortunately, insurance does not cover this. Insurance is great for acute care. It's just not so good for chronic conditions. So we want to empower you to take responsibility for your health. We want you to see if this makes sense, if it adds value, to come. So we are here basically, we want to get people better that don't have anywhere else to go. We are usually everybody's last hope. Again, we see files that are huge, and then we uncover and we get people feeling better. We love that. That's why we're in this business. We love reinventing someone's life and really making a life-changing difference. So we want you to know that we will do anything within our power to work within your finances. So we look at it, if we give you the information and you don't do anything about it, then it's not going to help you. So set an appointment. Come in for a consultation. $195. We'll go over your labs and we'll kind of get you on the right path. Until then, though, we want to give you a few things that can potentially help you along the way. So, #1, change your diet. You have to get off the red meat, the caffeine, the alcohol, the trans fatty acids, the white flour, the fruit juices. Need to increase your amount of fresh organic vegetables, increase your daily intake of water, at least half your body weight every day. Vitamin D, it's great. We give it to just about all our patients. We recommend nutrition supplements. There are certain ones that we really do like. I kind of went over the ones that modulate the immune system. Good oils, good fats, coconut oil, olive oil, avocados. If you're going to cut out a few things from your diet, the 3 main ones: gluten, dairy, soy. Those are what we're seeing over and over as the inflammatory markers. So you need to get out and exercise, and then read the labels. No more natural flavoring. So a couple final thoughts. We want you to picture yourself getting better and doing the things that you love to do. If you love to travel, participate in a sport, go back to school, whatever that is for you, see yourself spending more time with your family and your friends. We want you to ask yourself the following questions. How has your thyroid problem affected your relationships, finances, family, and or other activities? What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 2 to 5 years if you don't do anything? And 4, what is it worth to you if we can improve your condition? So I hope you realize today that a thyroid diagnosis is not a death sentence. It does not mean that you have no chance of living a long, happy life full of energy. Your body will heal, but it needs the right tools and equipment that we will help provide you with. So if you would like to email me with any questions, my email is dr. my last name, VESELAK, Dr. Veselak @gmail.com. I'll be glad to answer your questions. Our office phone number is area code 805-482-0723. And our website is